Primera, topic rivaroxan in patients with heart failure. Application in nursing, pros and cons, conclusions, issued applied in Ecuador definition. Definition. Rivaroxaban is an oral direct factor inhibitor that reduces tambourine generation that threatens improving outcomes for patients which were something chronic heart failure and coronary artery disease, since heart failure is associated with activation of thrombin-related pathways which predicts a poor prognosis. The variety of indications include 1. Treatment and prevention of venous thrombosis. 2. The prevention of stroke or system embolism in patients with atrial fibrillation. Low dose of rivaroxaban in combination with antiplatelet agents.
This lesson is about sinus rhythm. In a normal heart, the SA node is the primary pacemaker of the heart. And it sends an electrical impulse that's spread across the electrical conduction system that causes atrial depolarization, which produces a positive deflection on the ECG tracing. We call it P wave. Travels down through the AV node, where it's slightly delayed, down through the bundle of His, down through the bundle branches, causing ventricular depolarization and your QRS. And then, of course, repolarization. And this is the normal rhythm for a normal heart. This is repeated. After repolarization is depolarization again. And this is the normal rhythm for your heart. Now, the SA node is the primary pacemaker, and it paces the heart in a regular way between 60 to 100 beats per minute. That's what's expected to be normal. Now, sinus rhythm also has a regular R to R interval, and it's regular because those cells, we talked about, those pacemaker cells have sodium and calcium, right, rushing into those cells at a pretty regular rate. Unless it's modified by your body, those cells reach that state of depolarization about the same time every time. And so it produces a regular rhythm. So your R to Rs should be pretty much evenly spaced. You have a P wave for every QRS, so there's a 1-to-1 ratio. So I have one P wave for every one QRS. And that makes sense because...
Application in nursing. Rivaroxaban anti-implants. Reduce the risk of death from cardiovascular causes, myocardial infarctions and stroke, and patients with acute coronary syndromes or stable coronary artery disease.
Sinus tachycardia is a condition in which the heart beats faster than normal. The heart rate is controlled by electrical signals generated in the SA node and sent across heart tissues to make it contract or beat. The SA node is a group of cells located in the wall of the right atrium of the heart. When these electrical impulses are transmitted normally throughout the heart tissue, it is referred to as normal sinus rhythm. Sinus tachycardia occurs when the heart generates rapid electrical signals that accelerate the heart rate beyond the range for normal. As per the definition, a heart rate of more than 100 beats per minute in an average adult constitutes sinus tachycardia. Generally, it is considered to be a harmless faster rhythm that happens with fever, excitement, and exercise. Scientifically, it is a response of the body to certain situations, such as exercise, anxiety, sudden outbursts of emotions, and states that induce sudden feelings of stress, fright, flight, or anger. It can also be caused by anemia, heart failure, hyperthyroidism, sepsis, dehydration, electrical shock, obstructive lung disease, and heart attack. Intake of caffeine, nicotine, cocaine, amphetamines, or other stimulants can also cause sinus tachycardia. Some of the lesser-known causes are Kawasaki disease, pheochromocytoma, pulmonary embolism, and malignant hyperthermia. If a person is detected to have sinus tachycardia with no apparent reason, it's called inappropriate sinus tachycardia. Very often, sinus tachycardia does not give rise to any symptoms and settles on its own. However, if the heart rate is too high, cardiac output may fall and there may be increased workload on heart, giving rise to chest pain, palpitations, dizziness, shortness of breath, fainting, nausea, and heaviness in chest. Sinus tachycardia is easily detected on the ECG, but if heart rate is above 140 beats per minute, diagnosis can be challenging. In such cases, sinus tachycardia can be differentiated with other, more serious types of tachycardias by carotid sinus massage or Valsalva's maneuver, or by administering AV blocker medicines such as adenosine and verapamil. Sinus tachycardia often settles on its own. However, it can be hard to treat since if the underlying cause is not understood properly. Depending on how fast the heart rate is, the doctor might prescribe beta blockers or calcium channel blockers medicines. It is beneficial in the long run to avoid things and activities that could increase the heart rate, such as recreational drugs and emotionally draining situations. It is important to eat a heart-healthy diet, achieve physical fitness by exercising, and maintain a healthy body weight. For the cases that don't respond to medicines or lifestyle changes, a cardiac ablation procedure is needed. In this procedure, energy beam is used to destroy a tiny part of the heart tissue that's causing sinus tachycardia. The bottom line is that the treatment will likely involve a combination of medications and lifestyle changes if sinus tachycardia does not get corrected automatically.
Pros. Facilitates adherence to drugs. Extends contraindicats in severe renal failure. Those require adjustment for age. Dyslexia does increase shortest whole life tendency to reduce ANI. Cons: anemia, nausea, uncommon symptom, tachycardia, drugs, interaction spirit. Issued appellate in Ecuador, rivaroxan and dose of 2.5 and NG twice daily was not associated with a significantly lower rate of myocardial infarction or stroke than placebo among patients with worsening chronic heart failure, reduced left ventricular ejection fraction, coronary artery disease, and no arterial fibrillation. Conclusion: rivaroxan and dose of 2.5 mg twice daily was not associated with a significantly lower rate of death, myocardial infarction, or stroke than placebo among patients with worsening chronic heart failure, reduced left ventricular ejection fraction, coronary artery disease, and no arterial fibrillation.
Before we can talk about arrhythmias, the first thing we should look at is normal sinus rhythm, which is how our hearts are going to act when nothing is wrong in the electrical conduction system. With normal sinus rhythm, you'll see a rate between 60 and 100 beats per minute. Anything higher than that becomes labeled a tachycardia of some sort. Anything below that becomes labeled a bradycardia of some sort. The rhythm itself will be regular, meaning that each ratio marches out, whether that's P wave to P wave or QRS to QRS. The P waves will be present and they will be all normal. The PR interval will be normal as well. And as you'll recall, a normal PR interval is going to be within one large box on your EKG paper. The QRS width will also be normal. Remember, a normal QRS is less than 3 small boxes on your EKG paper. If you have all those things present, pretty good chance you're looking at normal sinus rhythm.